Thanks for tuning in. I'm Anvi Raja and you're watching The Urban Debate. On today's show, what we're going to do is put the spotlight on a lot of the information surrounding COVID and what we need to know with regard to various issues. Now, we are in a situation today where some parts of the country, it is very grim. There is a shortage of oxygen, there's a shortage of beds, and the doctors and the medical fraternity is working round the clock to ensure that everyone gets the best possible treatment and is able to manage this disease. But amidst all of that, there is also a lot of misinformation that is going around. There is too many things that one has to keep track of, too many various WhatsApp forwards on social media, and that is causing a lot of confusion. And to add to that confusion, we now are facing a situation where there is a shortage of vaccines. So a lot of the questions arising over what happens if you miss that window between the first and the second dose, that is also one question that is cropping up at this point in time. So our effort and our attempt today is to try and sift through all that information, to try and get you what you actually need to know from the best medical experts of the country at this point in time, the panel that we have. And our phone lines are also open at this point in time. So the three buckets that we are going to focus on today, the first, of course, is going to be vaccines, everything surrounding vaccines, the questions that all of us at this point have on our minds. That is the first bucket. The second one is with regard to testing, because again, there are a lot of questions that are being raised surrounding the testing methods, what you need to do and how to go about it. And third, of course, is the treatment itself as far as COVID is concerned, as far as the COVID symptoms are concerned, when you should do and what you should do. So that is really what we're going to focus on. Our phone lines are open, so please call us with any specific questions that you may have and we'll get our expert panel to answer them for you. Let me introduce my guests who are joining in today. Dr. Ashok Seth, cardiologist and chairman of Fortis Escorts Heart Institute. We've also got Dr. Jeenam Shah, consultant interventional pulmonologist at Wockhardt, and Dr. Suneela Garg, member Lancet Commission COVID India Task Force, and Dr. Priya Sampath Kumar, Chair, Infection Prevention and Control, Mayo Clinic, and Head of Immunization Committee as well. Thank you, all of you, so much for joining us. So, like I was pointing out, the idea today is just to answer as many questions as possible and focus on a lot of the questions that have we've sort of sifted through all the questions on social media, the calls that we've been getting, and sort of put out all of those questions. So I want to just get straight to it without wasting any time because we've got a lot of ground to cover. Focusing on vaccines first. In fact, Dr. Priya, if I can come to you first. The biggest question today on everyone's mind is with regard to the second dose of the vaccination. If you miss the window, then what? Because there is, like we're all aware, a shortage of vaccines in many parts of the country right now.
So with the new COVID vaccines, the trials always have to have a strict protocol. So they used set time points at which they gave the second dose. That's how a trial is always done. But in real life, all the vaccines that are available are inactivated vaccines. And with our experience with other inactivated vaccines, if the vaccine is given the second dose is given too close to the first one, it will not be as effective. If you give the second dose later than the date it was supposed to be given, really there's no significant decrease in efficacy. So don't worry if you have missed your second dose, just go ahead and get it when it's available.
Right. So you're saying there's no decrease in efficacy. So if I'm if the window is say 8 weeks, like for a Covaxin, and if I take it after 10 weeks, it's not going to impact in any way the efficacy of that, vaccine.
Yes. And, a lot of policy experts are afraid to say that because, again, that was not what was studied in the trial. But in the practical world, and with my background in vaccinology, I can assure you that there's no harm and people should stop worrying about it. Get the first dose when you can and get the second dose anytime after the due date for the second dose.
All right. Dr. Suneela Garg, if I can come to you here, now, of course, if you want to add anything to that. And the other part to this specific question is, what if one gets infected between the first dose and the second dose? Then what happens? Because inevitably it gets delayed, because you have to wait a certain point after you contract COVID. So how do you manage that gap?
Yeah, Avni, very, very important question, and thank you for having me on the show. First of all, I'll say that, even in connection with the pediatric immunization program or with adult immunization program, we never restart the immunization. That is the fundamental principle. So whatever doses you have received, you have to continue at the next dose. So in this case, as has been pointed out very rightly, that you must take your second dose whenever it is available to you. And also, since now there is shortage of vaccine and you are not able to get for some time, because our attempt is to cover also as many number of people as possible. So it is always better, whenever you get the second dose, you should go ahead with that. For Covaxin, we are talking about, the government of India has talked about 6 weeks, and for Covishield, it is 8 weeks. And even if you can go it up till 12 weeks, the better is the, seroconversion, and better is the efficacy. That is the most important thing which you have to remember with regard to the vaccination part. What was your second question? I just...
The second question was simply that, if you get infected between both the doses, then what do you do?
Yeah, then you have to wait for, about a period of... so you see, nowadays we are also getting a scenario that, because we are not testing anybody, before giving the vaccine, the person has turned out to be positive and has also taken the second dose. That is one scenario. But, if you have got infected, then you should better wait for a period of, you can delay it by 12 weeks and you can take the... Because this is another kind of a, antigen introduction through the help of your infection, or through the infection, and then you can go ahead with the, the second dose of the vaccine. And preferably by about 90 days, you should take that. That is 3 months. 3 months.
What viewers...
Okay,
Yeah.
all right. And just to sort of... Right. So just to add to that, if I can go across to Dr. Ashok here, if I have COVID and, if I take the vaccine and then I realize that I have symptoms and I test for COVID, is there any sort of impact that could have?
So your question, by the way, your question is that if you have a vaccine as well as have COVID at the same time, is that what you're saying?
Yeah.
No, there is no impact for that.
Yes, and you realize after you've taken the vaccine that, you've tested positive. Okay.
So we must remember that there's no impact of that. Yes, you cannot, you would get your vaccine at the time you want, and you may actually acquire COVID in the previous, the incubation period is 1 to 14 days. So you could have had contact before that. And if you do get COVID, certainly one thing you've got to understand, it is not due to the vaccine. It's due to acquiring it prior to the vaccine in the incubation period. A lot of people have had it, by the way. I know of people who've had COVID 3, 4 days, 5 days after having had the vaccine, where they have thought that it is because of the vaccine. I want to assure people it's not the vaccine itself, it's the prior infection, because the incubation period is 1 to 14 days, and it doesn't matter. The second aspect, I think there's another aspect to your question. And by the way, the immunity from the vaccine actually starts by 3 weeks' time. And a single dose can offer you up to a 65%, 60 to 65% safety and immunity, which therefore means that that is the data that the Indian government also showed, that there was 0.02% infection with COVID or COVID disease after the first dose and 0.04% after the second dose. So the full immunity is, of course, 2 weeks after the second dose. And that's where you get to that 70, 75% efficacy of the vaccines. But you still get good efficacy, and you can also prevent disease process from spreading in your own family even after 3 weeks after the first dose. I think that's an important aspect. And by the way, Britain has a policy of giving 1 dose only up to 3 months. And WHO has also recommended that the second dose may be taken 3 months after the first dose.
Right. I think they're very important to hear that from all of you, and probably give solace to people who are extremely worried right now about what happens if they miss the window there between the two doses. But the other, very important question that keeps cropping up is with respect to whether one is a risk to others after being fully vaccinated. So you do feel that you have some level of safety after you're vaccinated. Of course, there's not 100% efficacy, but to some extent. But Dr. Shah, if I can come to you on this, how would you explain this in terms of how one should interact with others and the risk one could pose to others after being vaccinated?
So that's a very important question. So basically, vaccines prevents you from, the basic idea about the vaccine is to prevent you from severity of the disease. That's the first most important thing. So once a person gets vaccinated, fully vaccinated, and after 3 to 4 weeks of the second dose, you protect yourself from getting a very severe disease. That's the first most important thing. But at the same time, it does not mean that you're not going to get infected. It provides certain amount of immunity, yes, but it is only up to 70 to 90%. So you're still likely to get infected. In the case that you get infected, your disease severity might be very less. You might be asymptomatic to mildly symptomatic. But at the same time, you can still spread the disease to other people around you. So that is very, very important fact that even after getting vaccinated, you still need to take the COVID precautions. You still need to do the basic sanitation process to prevent it from spreading to other people around you.
Right. So, Dr. Priya, if you could add to that here, because I just want to reiterate this point that just because you've had the vaccine doesn't mean that you can sort of let go of the COVID protocols, and doesn't mean that you are not still putting others at risk. So, COVID protocol, maintaining that even after vaccination is extremely important.
Yes, exactly. So vaccination does reduce the risk of overall infection by about 60 to 70%. It reduces the risk of dying if you get infected by more than 95%. So it's very effective at preventing death, but not so effective at preventing infection. And that's okay, because ultimately, if you get infection, almost always the infection is very mild. But because of the fact that it's not completely effective at preventing infection, people who are vaccinated should continue to wear a mask when they're in a situation where they could be exposed to COVID. So anytime they leave the house, anytime an outsider comes into the house. Because cases are so high in India right now, anybody coming into the house is potentially infected. And because you're vaccinated, you cannot let down your guard. And yes, sanitation is important. The single most important thing, though, is continuing to mask.
Right. And Dr. Priya, if I can just add another question here, because this is once again where there are those who say that it's fine, but then there's no official guideline as far as pregnant and lactating women are concerned, and whether or not they should go ahead and get the vaccine or just hold off for now.
So I'm glad you asked me this question. The studies did not include pregnant women, did not include lactating women, because that's the nature of studies. That's how studies are done. The first studies always exclude these people. So but right now, when COVID is so prevalent in India, we know that pregnant women actually have much poorer outcomes if they get COVID. So the risk of them progressing to severe disease is high. So in this scenario, I would say definitely the benefits from vaccination outweigh any risk from the vaccination in pregnant women. And I think there's some Ministry of Health guidelines that say avoid vaccination in pregnancy. And I would say that is really not the right advice. Pregnant women definitely need the vaccine.
Okay. And lactating women?
Lactating women, definitely. There's no issue at all. Both those cases should get vaccinated. And I'm just so pleased to
Dr.
be on.
Suneela Garg, if you would like to add anything here, yes.
I was saying the panelists be on.
Now, as we mentioned that basically the guidelines still
Dr.
ministry say that we should not be giving to the pregnant women, and we have to explain to them also that basically that if they want to come, you see right now it's a question of that if they want to come and take the vaccine, so we cannot deny the vaccine to them. But as far as the ministry guidelines are concerned, we have to be cautious, and we have to tell them that as of now we have to change the guidelines. But to lactating women, as has been pointed out, that we must give that is important. Another thing which I was telling was that when you go even for the vaccination, because we don't want our vaccination spots to become the hot spots. So even at that point of time, even people who are vaccinating or people who are taking the vaccine, they must be, following proper COVID appropriate behavior. It should not be that instead of getting only the vaccine, they get also the infection over there, which is also happening, in these cases. So it is better that they maintain, a distance, what we say it as, 2 gaz ki duri, and they have to wear, the double mask and all that. And we have proper provisions of, sanitization over there. So that is one thing which is most important. And I will also like to add one more thing, that quite a number of times, people go empty stomach and they don't feel nice after getting the vaccination. So they must take some breakfast or something like that, and then they must go ahead for the vaccination. That is another important.
Right. And Dr. Suneela Garg, just one more addition to this, one more part to this, because this is something that I also have personally, heard these questions as well, is menstruating women who are afraid, say that, I have my period, I can't go and get vaccinated. Of course, it is nothing to do with each other, but this something needs to be sort of reiterated that there's absolutely nothing wrong.
So very right. You asked day before only I was discussing with Dr. Paul that this is kind of a myth which is now coming up. So menstruating women, in those women, there is no contraindication. All the, girls, who are 18 years of age and they are menstruating, or anybody, and during the menstrual cycle, they can go and take the vaccine. It is so safe because menstruation has got nothing to do with the, taking of the vaccine. That's it.
All right. Okay, well, those were a lot of, very important questions with regard to the vaccination point of view. I want to now move to the second bucket, which is as far as COVID testing itself is concerned. And like we know right now, there is a shortage of even tests right now. People are not able to get tested in time and they have symptoms, they're waiting for days. So what does one do in such scenarios? Dr. Ashok, if you have symptoms, but you have tested negative, in your RT-PCR test, what does one do?
So we must understand that no test is 100%. An RT-PCR at its best has a sensitivity of picking up COVID at around 70 to 75%. And by the way, there are 50 kits in the market with various levels of sensitivity and specificity. With the COVID test positivity matters as to the time when it is done. It may be done too early, where the virus load in the throat or nose is less. If it's not tested, if the swab hasn't got deep enough. Secondly, the way it's transported. Finally, the way it's done. All those affect the positivity rate of the test itself. We never treat the test, by the way. And in the present scenario, where a flu-like symptom at this time has to be practically certainly is COVID, we look at the whole patient itself. So if there is cough, runny nose, fever, along with breathlessness, then we look at the blood tests. We have the ability to do other tests. And finally, we have the ability to monitor the patient. And if the breathlessness progresses to low oxygen, we have the ability to do a CT. We put everything together to diagnose. And by the way, the next test after a negative test, and if the picture is typical, and if respiratory involvement starts occurring, is clearly to repeat the COVID test. If one test is negative, it doesn't rule it out. We have 2 or sometimes 3 tests. The only issue is, by the way, and I want to emphasize this to the public, what happens is that they think for 2 or 3 days that is just a common flu, which it is. COVID is a common flu. It actually has symptoms of flu. But at this stage where the whole country has a community spread, we must remember that it is COVID, not just it is a flu. And secondly, that we must isolate ourselves the moment we have a flu-like symptom. That's the second aspect. The test is done, and with the waiting times that there are, we may get a test after 3 to 4 days. If we haven't isolated, we would be spreading it. And finally, I think it's very important to consult a doctor and stay in touch with the doctor so that treatment is started and monitoring is done appropriately. Mild symptoms do not require any specific treatment apart from symptomatic treatment. And in fact, if you hydrate yourself well, if you remain positive, if you do moderate level of exercise, if you sleep well and follow the protocols of peace and meditation, you would actually get over this common cold-like symptom in 90% of the instances. And the only reason for getting in touch with a doctor is that you're under supervision, you monitor your oxygen saturations regularly, and not just your oxygen saturations, you monitor your temperature, you monitor your heart rate, and you actually do a monitoring of your oxygen saturations before and after a 6-minute exercise for the young and 3-minute exercise for the elderly. And then if the temperature continues for a longer duration, continues at a high duration, or the oxygen saturation stop dropping, either on exercise or at rest, you are under supervision of a doctor, and that's when you can converse with the doctor as to what to do now. Because you're passing into a second phase after 5 to 7 days, and if you are, the doctor would advise you what are the next steps to take for that. It's very important not to try and treat yourself. It's very important not to be callous about it. It's very important to be careful about it, but not to worry and panic about it.
Yes, absolutely. Not to treat yourself. That's a whole other issue that, we're seeing a lot of at this point. And we'll come to that in just a bit. But Dr. Shah, just taking forward that point, and the importance of the 6-minute, walking test that needs to be done before you take your own, before you do your oxygen check, because you have those pulsometers that people have at home now and, do these checks. How is that really helpful, or should you just ensure that if you need to do an oxygen check, it should be, if you're looking at symptoms at all, it should be after the 6-minute walk test?
So it's a very important thing that 6-minute walk test is definitely very, very helpful. So it helps us in triaging patients who are, likely to deteriorate. What is basically a 6-minute walk test? It's basically when you're walking at your own speed for 6 minutes, it shows that, how much your oxygen level is dropping. If your lung involvement due to COVID is more, that means that more than amount of lung is involved, there are chances that your oxygen levels will drop even further. So it's an indirect assessment. I would say that even before a CT scan, this is more helpful, because if you have a significant lung involvement, what will happen is when you are just static and you're checking your oxygen levels, it will be normal. But if any drop of oxygen level more than 3 to 4% after walking for 6 minutes would tell us that there is a significant lung involvement, we need to do further about treatment, whether it is about hospitalization, whether it is about doing a CT scan, but it definitely helps us in triaging the patients. But again, we need to consider a lot of aspects to this. Most of the pulse oximeters that we have at home are not really sensitive enough to pick up this kind of oxygen desaturations, because a lot of the companies are available in the market. There are a lot of variations that happens. We cannot rely actively upon only the 6-minute walk test. We have to consider a lot of aspects to it. What are the clinical symptomatology? Cough is a very important marker. A person who is coughing a lot means that the lung involvement is very, very significant. So that helps us in picking up early cases where the lung is probably more infected. Apart from that, more the amount of fever the patient has, it is linked to more severe the disease. People who have fever for more than 5 days, 6 days, which is high grade, more than 101, 102 degrees Fahrenheit, those people tend to do worse in the second week of the illness. So it's a constellation of all the clinical symptoms. But yes, I would definitely do a 6-minute walk test at the 5 to 7 days when the patient is still persisting to have fever, and I need to triage the patient whether the patient would require a hospitalization, whether the patient would be a candidate, it's likely to go into a storm or not.
Yes, absolutely. Extremely important points there that you've mentioned, Doctor. But we've got a caller on the phone line. Martin is calling us. Hi, Martin. Thank you for calling in. What's your question?
Yeah, good evening, everyone. I had come to know that this Covaxin has more efficacy for this double mutant virus. But I had taken first dose of Covishield. Can I now switch to Covaxin?
Okay. Okay, all right, Martin, let me take that question across. Dr. Priya, essentially, he wants to know if he can switch between vaccines and, is that something at all that would be advisable?
In my opinion, no. But I want to hear from the others on the panel what they would say because they have more experience with the Covaxin and the Covishield. In my opinion, he got started and he shouldn't be vaccine shopping at this stage. He got a vaccine that is good at protecting against preventing death and hospitalization. He should wait to get the second dose when doses are more readily available. And if at that time only Covaxin is available, take it. If at that time only Covishield is available, take it. But the first dose of Covishield he got is protecting him now. And at this point, he shouldn't get Covaxin just because he would be taking a dose away from someone who's not protected at all.
Dr. Suneela, would you like to come in here?
Yeah, definitely. As has been mentioned very rightly, that as of now, basically, even, if we want, we cannot change. The guidelines were also like that we have to, we cannot switch over. Whatever first dose we have received, we have to continue with that. But as of now, I will say that, what has been the newspaper reports or, the different studies, they're all, a kind of, researches which are being carried out. But I will say that, as of now, both the doses are effective. So we recommend that please take, your second dose at the required period of time, because though we are facing the, mutants, but as of now, the vaccines have not looked in depth about, the mutation part and all that, and, the antibody response following that. So he must take the vaccine of the same, Covishield, what he took at the first point of time. And I'm sure that will protect him from the, strains as of now. And most important is not to get confused, and he should go ahead with the same dose of vaccine from the center which he wants to take, and even he will get, as per program also, the same vaccine what he has been given the first time.
All right. So, Martin, don't switch vaccines. Stick to Covishield, and you will, be sufficiently protected. No vaccine is 100% effective. So, hope that answers your question. We've got another caller, Pramod Sharma from Mumbai, on the phone line. Thank you very much for calling in. Go ahead. What's your question?
Yeah, this is Pramod Sharma, aged 62. I took my second jab of Covishield on 26th morning, and for 2 days there was no fever and all these things.
Right.
After 2 days, say third day, when I got up in the afternoon, I got around 101 fever was there. I thought, okay, I talked to a doctor. He said it should be 24 to 48 hours. Generally, it remains. But what I am having here is even today I got a 99 fever after that, but it is almost 8 days. So can this after effect of this, although my saturation level is okay, my pulse rate is slightly high, that is 115 or so. Otherwise, I am feeling nothing. I got my this thing done also as a precaution, that PCR is negative also. So I just could not understand whether it can last for 8-10 days or not.
So that's good news there. But
very low grade fever. Which
let me take that question.
Yeah.
Yes. Right. So let me take that question to Dr. Ashok Seth, if you would like to answer that.
So fever is a common reaction. It can occur 24 to 48 hours later, but usually lasts for no more than a couple of days. Any fever lasting longer than that certainly needs a concern. It doesn't mean that it can't. I've had a few patients who've had fever for a week, niggling fever, which has gone away. But he did the right thing, because after 48 hours, if we see a continuing fever, then we're getting concerned about a coincidental COVID in the present times, as you know, that it is so widespread and that cannot be excluded. So he did the right thing to do an RT-PCR. He didn't have flu-like symptoms. He's just got fever. He did the RT-PCR, which was correct. And I do believe that he should also see his doctor, because I think if the fever goes beyond 7 days, we should actually have a better look at the whole circumstances.
Right, absolutely. So, Pramod Sharma, if your fever doesn't subside, then it may be a good idea to visit your doctor or get an online consult, whichever one is convenient to you. Hope that answers your question. So, I want to go back to the other discussion we were having with regard to testing. And Dr. Shah, if I can come to you here, to talk about the CT scan now, because what we are seeing is that very often people are going in for a lot of CT scans, multiple CT scans, and especially in light of the fact that there's a shortage of RT-PCR tests in some places. What exactly is the recommendation when it comes to using a CT scan to determine whether you have COVID or not?
So yes, that's it's been rampantly, used. CT scan has been rampantly used in the country. In fact, in the place where I reside, Mumbai too, it's been abused, I would say. So basically, you don't need a CT scan in maximum cases.
Yes.
When you are having a mild disease, when the oxygen level is normal, maximum symptoms that you have is of flu, mild fever here and there, mild myalgia. You don't need to do a CT scan at all, because CT scan is not going to help you in any ways. The treatment still remains as mentioned by Dr. Sheth, is going to be hydration. Just take your paracetamol tablets whenever you have fever. At the max, you can take some multivitamins, at the max. But there's nothing else to be done besides this. What will happen unnecessarily? You keep on doing the CT scan, you are exposing yourself to radiation. One CT scan would be equivalent to roughly around 400 X-rays. That's a sizable amount of radiation that you're taking in. And if you're going to do multiple CT scans, more the radiation, and radiation increase is linked to the cancer also. So you should definitely avoid any kind of CT scan if your oxygen levels are remaining normal. That's the first and foremost thing. Now coming to the moderate and severe disease, when you're having an oxygen level which is dropping below 94%, that is the time that you have to triage yourself. I mean, triage the patient, whether the patient needs a CT scan or not. Yes, I would do in those kind of circumstances if I have a ready accessible CT scan. It will help me decide how severe the infection is. But again, only a CT scan is not going to tell me whether the infection is very severe or not. It is a constellation of oxygen levels, constellation of lot of factors like what is the age of the patient, what are the comorbidities like, whether the patient is in which kind of setup. If I have a setup where I don't have a CT scan, I don't mind that. I'll still be treating the patient based on just the symptoms and what is the clinical picture like. I would use a CT scan in patients who are RT-PCR negative. So RT-PCR negative, when it's two RT-PCR negatives, I'm not sure the patient is still spiking fever. Then I would use a CT scan as a mode of diagnosis. It will tell me whether the lesions in the CT scan are appearing like COVID or not. So if it's appearing like COVID in spite of two negative RT-PCRs, I would still, considering the current situation of the pandemic, I would still consider it as a COVID-19 disease, and I will treat it as a COVID-19 disease. And apart from that, when you're talking about the severe diseases, when the patient is requiring an ICU care, the oxygen requirement is very, very high, the patient is on a high flow oxygen support, that I would do a CT scan. It would definitely help me in first confirming that it is a COVID-19 disease. I'm not looking at any other infection like a secondary bacterial infection or a fungal infection that is happening along with it. So it will help me in deciding whether I just need to give an COVID treatment, or I need to give something else also. Obviously, it's not just the CT pattern that is important. It is going to be based on multiple factors like what are the blood parameters like, what are the inflammatory markers like. So all those things decide into whether I would need a CT scan or not. But in mild cases, the take home point is never do a CT scan, and repeating a CT scan after a few days also doesn't help, because invariably what happens is COVID in the first week of illness is only a mild disease. It is only in the second week of illness where the symptoms increases. That is because it goes into hyperinflammatory state. That is the time that you're going to see that lot of changes in CT scan happening. So invariably, when you do a CT scan in the first week and then you repeat it again in the second week, you're going to see an increase in lesions. That does not mean that the disease is getting bad. It's just the natural course of the disease that it is. It is why the increase in lesions are seen. And follow-up CT scans again are not very important, because it's going to remain like that only. It's like any infection in the body, it leaves a scar. So if you're following up with a CT scan, what will happen is you'll see the same amount of scarring the next time also, and you'll be confused that this is because the illness is already there and it's still continuing. That is why my CT scan is showing so bad changes. So those are the factors which help me deciding whether you need to do a CT scan at all or not.
And I would just like to add one point to that.
Right. Dr. Suneela Garg, if I can just... Yes, please go ahead. Please go ahead.
So just like repeating the CT scan is not useful, the other question that I get a lot is my PCR test is still positive on day 7 or day 8. Repeating the PCR test is also not helpful. You don't need to wait for a negative test. And right now, even testing supplies are in short supply. So you should not be wasting a test by trying to figure out if someone has turned negative or not.
And also,
right.
if you want
actually, I'm glad you mentioned that. If you can just elaborate a little bit, why doesn't it matter? Why doesn't it matter whether you, after a certain point, if you have a negative or a positive? So after day 8, to check for a negative, and even if you are not negative, if you are still positive on day 8, why is that not a problem?
So the RT-PCR test is looking for virus, and it's a very sensitive test. It picks up very, very, very small amounts of virus. And the test also just tells you that virus is there. It doesn't tell you whether it's live virus or dead virus. So if you're doing well, if clinically you don't have a fever, if your oxygenation is stable, the PCR test adds nothing. You can have a PCR test. And sometimes because PCR tests are so sensitive, you can have a positive PCR test for up to 180 days. And that just worries you. It doesn't mean anything. You're not infectious to others. If your symptoms have improved and if your levels are low, it could just be dead virus. So all it does is increase anxiety in people who get a positive test a few days after the first one. So it should really not be done at all.
All right, extremely important point there. We've got another caller, N. Subramaniam from Chennai is calling us. Thank you so much for calling in. Please go ahead. What's your question?
Madam, good evening. I am Subramaniam from Chennai. Hello, are you able to hear?
Yeah.
Are you able to hear?
Yes, please go ahead. We can hear you.
I took a Covid-19 on 10/3.
Yes, we are able to hear you. Please go ahead.
10/3. After 3 days, on right eye, some slight defect has happened. Immediately, I rushed to the Sankarnetha ophthalmologist. There, I took the extensive test, and I came back, and he is, after consulting cardiologist, I took one more blood thinner because I am bypass patient for the past 10 years. So all of a sudden, on 4 March, April, I lost my vision, right vision, totally gone. So immediately I rushed on Sunday. Immediately rushed, and they again I conducted various tests and find out the retina specialist has told you better to consult your cardiologist again. So again I back to my cardiologist. Cardiologist suggested neck and brain angio. After taking neck and angiogram, I find out in my left area of blood vessels is some 90% what you call block, but 10%. But that interventional radiologist says it's not the cause for this. So you continue to take cardio medicines to dilute it. Is there any other remedial measure for me to go further? That's all.
Okay, all right, Dr. Seth, I know that you would probably require, a little more history about everything that he's just said. But if you just had to guide him on how he should proceed further in terms of trying to figure out what's happening.
So let me just state that from what I've understood of this history, it's a complex history which the cardiologist is sorting it out, and he had a block of 90%, and clearly that's not related. That's a carotid blockage, and therefore I think he should just follow the cardiologist's advice. I think this is not the forum for us to be able to advise him on something as complex matter as this, but clearly it's not related to his vaccine. That's 100% clear. Now I just want to state one thing while this has been asked, and that's important because people worry about that clotting issue. And I think this is the time to actually address that clotting issue as well, because a lot of people have been concerned about the fact that thrombosis can actually happen. There have been reports of that. And certainly some of the countries had for some time stopped giving COVID for Covishield, and this is specifically for Covishield, had stopped giving Covishield, the AstraZeneca Oxford vaccine, to at least had stopped it for some time, a couple of weeks, and then reviewed the data. And some of the countries have stopped it or has offered alternative vaccines to at least young individuals. So let me just clarify that. Firstly, the clotting issue has come to light and is a rare, very rare, to the tune of 0.0004% possibility, which occurs in young ladies somewhere around 10 to 14 days after a AstraZeneca Oxford vaccine. Certainly not sure whether it's directly related or coincidental, but with that form of rarity, if I was to able to tell you that it's so important to have the vaccination because you have at least 100 times higher chance of getting COVID. In fact, at this time, 1,000 times higher chance of getting COVID. And also in COVID, you have a very high chance of getting clotting and leading to the same problems. And by the way, this clotting was rare, sometimes in the intestinal arteries, sometimes in the brain arteries presenting as headache, and has absolutely no correlation. We're still awaiting the Indian data, but at the moment, it is extremely, extremely so rare that most of the centers which have inoculated, we now have, as you know, close to 15 crores of inoculations being done, out of which majority are with AstraZeneca, Oxford, Covishield vaccine. It's certainly not come to light in our own country, and therefore no one needs to worry about it. One needs to get vaccinated. There are no important side effects. Any effects are so extremely rare that they don't even fall into chance versus cause is not yet determined.
Yes, absolutely, Dr. Seth, and that is such an important point because yes, that is the other number of questions that we get with regard to the vaccine and the clotting issue that people ask about. So thank you for bringing that up as well. All right, let's now move to the third bucket, and again, this is extremely important because like was brought up earlier as well, there are a lot of people who are going self-medicating or over-medicating, and all of that is then leading to a sudden deterioration in one's illness and having to be urgently hospitalized and resulting in all other kinds of complications. So Dr. Suneela Garg, if I can start with you on this, as far as steroid use is concerned, it's something that we're seeing a lot at this point in time, and it's also, a lot of the other doctors who I've spoken to say that that's one main reason why there are a lot of people who are deteriorating so fast, because they start steroid use way too early, and if they are asymptomatic. But what's the advice that you would have here?
I think it was mentioned by Dr. Seth and Dr. Shah also that, primarily if we are looking at the person is mildly symptomatic and he is there in the home setting, he should be in contact with his physician from the very beginning, from day one. That is one thing which is very, very important. And he should only take paracetamol, vitamins and zinc on his own, nothing beyond that. Even if he wants to take, when we talk of hydroxychloroquine, or he wants to take ivermectin, any medication besides this has to be taken in consultation with the doctors, because usually what is happening is on 5th day or 6th day, they feel that we are uncomfortable and let's get our, CRP done and let's get our D-dimers done. And then, automatically you start taking the steroids. This is what is routinely happening, because this is what they discuss with their friends and this is how they start with the treatment. But I feel from day one, right from the mildly symptomatic person or asymptomatic person, if the test is positive or there is somebody who is positive in the family, it is better that you should presume that you are positive, because we are so much overloaded with the testing part that now you see we feel that even in a family, if one is positive, we should presume that the others are also positive. So it is better that the family healthcare provider is there, in touch with them, and whatever medication or whatever investigations are being advised, he should be following that. And today only the guidelines have also come, the Delhi government has suggested, because we are so short of oxygen that even our private providers have to learn how to give them at home setting also. So forget about the question of steroids and all that. They should not start on their own anything, only except paracetamol and zinc and multivitamins.
Right, absolutely, and that's extremely important. Dr. Shah, if I can come to you here, because the other part that we're seeing a lot on social media is people asking for remdesivir and, going to any extent and any amount to actually get remdesivir. But there needs to, be a little more understanding on what exactly remdesivir does and who it actually benefits.
So yeah, so remdesivir it's an antiviral drug. So first of all, we need to understand. I'll just try to club the steroid also part together in the treatment aspect. So basically, to understand the role of remdesivir, we need to understand the pathophysiology of COVID. So what happens in the first week of illness is the virus is spreading over your body. That is predominantly in the lungs. That is the time that the antiviral drug, that is remdesivir, which is again a repurposed drug, which is used for earlier another virus has been repurposed to be used in COVID-19 disease. There has been a lot of data initially that remdesivir does work in COVID-19 disease, but it only decreases the number of days of hospitalization. It has no effect on mortality at all. So even if you are taking remdesivir, does not mean that you are going to be saved from the disease. It only means that probably if you are getting a severe disease, the number of days of the hospitalization, amount of time that probably you will be on the ventilator decreases. But again, it's a controversial thing. There was a solidarity trial by the WHO which says that there is no effect of remdesivir. After that, again, there was a meta-analysis which says that remdesivir does help in decreasing the duration of hospitalization, but again, there is no definite evidence of mortality benefit by remdesivir. So that is the thing, that whenever you have a mild disease, you don't need remdesivir at all. In fact, when you are at home, there is no point of taking remdesivir. Only in moderate to severe disease, when your oxygen level has started dropping, which is less than 94 for a moderate disease, and if it's less than 90 for a severe disease, is the time that you can take a remdesivir. But again, remdesivir is not a magic drug. It does not mean that if you are taking remdesivir, you will get saved. So even if you're not getting one, don't panic. It's definitely in shortage. A lot of the cities, in fact, in the smaller centers, there is acute shortage. Even I'm talking today about Mumbai also, where the hospital that I visit, there has been a shortage of remdesivir. But we just try to calm the patient down. Even if you don't get remdesivir, it is not the end of the world. You still have good drugs available. That is predominantly the steroids. Steroids are useful generally in the second week of illness when there is a hyperinflammatory response to the COVID-19 disease. First week is about the virus spreading in the body, and second week is about the body responding to the virus. That is the time excessive immune response happens, and that is the time that the lungs starts getting more and more affected with COVID-19. That is the time that you end up using a steroids. Never use a steroid in the first week of illness. It is only in the second week of illness where it decreases the immunity of the body, and that is helps to preserve the lung predominantly. So remdesivir in in first week of illness, that is below the day 10 of onset of symptoms, is the time that you can use it. And steroids after this first week of illness, only in patients who are having hypoxia, not in other conditions in mild disease at all.
Right. Dr. Priya, would you like to add something to that? Because, not just remdesivir, there's HCQ, and also some doctors prescribe Fabiflu as well. So all of these drugs right now are in extremely high demand without people actually realizing whether or not it's going to help them or whether or not they actually need it.
So I just want to give a list of medications that have absolutely no proven benefit. So amongst those are ivermectin, hydroxychloroquine, favipiravir, lopinavir, ritonavir, which is an HIV medication that was tried out and did not pan out, doxycycline, azithromycin. None of these medications work. And exactly like Dr. Shah said, there's a tiny benefit from remdesivir if it's given at the right time. Now, remdesivir is extremely expensive. It needs to be given intravenously, and it needs to be given in the hospital. I don't know what the situation is like in Bombay right now, but New Delhi is currently having a severe crisis of beds. So keeping anybody in the hospital for 5 days of remdesivir is really not the right thing to do, because people are so desperate for oxygen and for hospital beds and nursing care and medical care.
Yes, absolutely. All right. Thank you for that. We've got Navratan from Nagpur who's joining us on the phone line. Thank you, Navratan, for calling in. Go ahead. What's your question?
Yeah. Hi. My name is Navratan. My question is, I'm just suffering from an autoimmune disorder, pemphigus vulgaris, and I'm just on a treatment of steroids.
Okay. Yes, please go ahead.
I'm just taking levamisole and prednisone for my treatment.
Navratan, please go ahead.
Yeah, I'm just taking medicines for my disease, levamisole and prednisone on alternate day basis. So can I just take jabs?
Definitely. Yeah, he's
Okay.
suffering from autoimmune disorders.
Doctor, yes, please go ahead.
So
Yeah,
yeah.
Dr. Seth can.
Did he say
yes,
that?
Dr. Garg, go ahead.
Did he say that he actually wants to take vaccination? He said, did I take a jab? It's not very clear what he said. But I guess he's asking us that should he take a vaccination? I think that's his question.
Yes, he wants to know if he can take the vaccine. Yes.
Of course. In fact, he should. And I'm again going to emphasize one very important aspect. He must take the vaccine because he's actually has the comorbidities. But it surprises me, not for this gentleman, but in general, the largest number of questions I get from people who should actually be the first ones to have vaccines. For example, patients come to me, I've had stents in, I've had a heart surgery in, should I take a vaccine? I've had this, should I take a vaccine? And I keep saying, emphasizing this every day, this is the group which is the comorbid, diabetic, hypertensive, immunosuppressants, patients who've actually had cancers, patients who got renal failure, patients who've had previous heart disease, lung disease. All this group should be coming forth and taking the vaccine first in the line, should I say, the first biggest priority group, which we said after the frontline workers and after the healthcare workers. Now, I want to emphasize one other important point which comes up. And while this question is asked, is the second most common question which is asked is, I'm on blood thinners. Should I take a vaccine? Remember how blood thinners were emphasized that they are contraindication to vaccine? I want to emphasize also the fact that majority of our cardiac patients are on blood thinners, which are aspirin and clopidogrel or clopidogrel. And these are very weak blood thinners. So we talk about them as blood thinners, don't consider aspirin and clopidogrel as potent blood thinners. And there are absolutely no contraindication whatsoever to take a vaccine, even when you're on aspirin or clopidogrel or both, which are prescribed in all heart patients, either for stents or for prevention of heart attacks. The issue comes in if you're on more potent blood thinners, if you've got a valve replacement or you've had clots anywhere and you're on potent blood thinners like called acetylene, warfarin, or the newer oral anticoagulants like apixaban, dabigatran. Now, when you're on those, you can still have the vaccination. There's absolutely no contraindication, but you must tell your doctor that you're on this, and he may just omit a dose, or he may just check your blood, how thin the blood is, and let you have the vaccine. All you've got to do is press at the vaccine site for 3 to 4 minutes, because these are very fine needles and not likely to cause you any problem. So no blood thinners are not a contraindication. Please go ahead, have the vaccine. Do not fear, and do not ask this question again.
All right, yes, Dr. Seth, that is an extremely important point, because the blood thinners aspect also is where a lot of questions are coming in. Dr. Suneela Garg, one final question to you here, and this is something that, again, a lot of people are asking about, who are experiencing symptoms 2-3 weeks after recovery. How does one, if you can just tell us, how does one deal with something like that, and what should be the protocol? What should one do?
See, basically, if there are symptoms which are occurring 2-3 weeks after taking the vaccine, and let's say if it is first dose or second dose of the vaccine, we have to...
Dr. Garg, sorry, I think my question wasn't clear. I'm talking about a resurgence of symptoms after you've recovered from COVID. Few weeks later, once again, if the symptoms are reoccurring.
Yeah, so primarily we will say that, it may be that the person has got infection. It can also be. That means you are telling that after 2 doses of vaccine, he has got the symptoms or he has recovered from the disease? I couldn't get your question straight. Just I presume that what you're asking is that if after there are symptoms after 2-3 weeks of recovery, again we have to see that whether it is definitely related to COVID-19. If it is, primarily, I will say that this may not be related to COVID-19. It may be some other infection as well. So that is where we need to look at and consult ourselves. Maybe another infection which is there,
Right.
and it will also depend on what kind of symptoms it is. Whether it's only high-grade fever, or it is only, pain in abdomen,
Right.
loose motions, like that way we have to look at the symptoms and consult our physician. That will be very important, because we need to look at that, because it doesn't look like that immediately after 2 to 3 weeks of recovery, this is related to, COVID-19.
Respond to that.
All right. I'm afraid we're completely out of time, but we've managed to cover a lot of ground, ask a lot of important questions. I'd like to thank all of you so much for taking out the time and answering all of these questions today at this point in time. And for our viewers, I do hope that this has helped you put some of the information that is out there in perspective. Because let's just take a moment and thank all our medical fraternity for doing all of that. And the one way we can do it is by ensuring that we don't fall for any kind of rumors, any kind of myths. Go with the right advice, go with what your physician is saying and not what your friend is saying. Look at experts like these who have taken out time from what they're doing, from their busy schedules, and come and answering all of these questions. So hope this show helps, and I assure you, if we haven't managed to take your questions today, we will do many more of these shows and we will take all your questions. Thank you so much for watching.